Good morning, everyone. Myself, Dr. Ruchi Jain. I'm from Nagpur, practicing predictive homeopathy since 2010. I did my BHMS from Nagpur and my post-graduation from MLD MHI Palghar. After that, I joined predictive homeopathy and henceforth, I practiced homeopathy from heart and soul, day in and day out. So I expect all the followers of Dr. Prafull Vijayakar sir to dedicate to homeopathy as what he did. Today, again, I am getting to you an interesting topic of rheumatoid arthritis, a topic which was long awaited and was in demand by everyone. And everyone wanted that I should share this with you people. And definitely, we'll begin with the journey. So let's begin the topic of rheumatoid arthritis. And so, taking blessings ahead from Dr. Prafull Vijayakar sir and our divine master, father of homeopathy, Dr. Samuel Hahnemann sir. A tribute to Dr. Prafull Vijayakar sir by teaching sadhana series session and taking ahead his knowledge, his teachings and his learnings ahead. So the topic today is rheumatoid arthritis, and I'm going to unlock all the features of rheumatoid arthritis and how to approach it through homeopathic mode of medicine, and what are the understanding or key features whenever you're dealing with the cases of arthritis. So as we all know that Dr. Samuel Hahnemann sir was far beyond his ages, and he worked markedly, industriously, and without stopping. His perseverance to gain the knowledge is seen through the work he has meticulously done in the form of the aphorisms he have shared. So, tribute to the great master, because he would always say that there is no limit to homeopathy. The doctor, homeopath himself, is the limit to homeopathy. So, if we have the knowledge in the mind, we will be able to see or perceive it through the patients. But if we don't have anything in your mind, you won't be able to interpret in the patient. So, let's see what is the exact understanding of rheumatoid arthritis is. So, when we are on the mission of becoming a true healer, or what he say, the true practitioner of this healing art, we are under the mission to restore the sick to health, as it is termed. When we are dealing with psoriatic diseases, when we are dealing with psychotic diseases, and when we are dealing with syphilitic diseases, the mission is same, that we need to give the cure to the patient. But every time it is not possible for us to understand the cases. So through the master's desk, we try to understand what way they have learned and they have taught us through the books and the references of the authentic literature which they have shared with us. And definitely, our patients, when we are in the mission of giving them that restoration of health, where we want to give them a permanent cure, we are just expecting that the results should be reliable. But as Dr. Prafull Vijayakar sir would always say, it is not a responsibility of a physician alone to singly handle. I want that whatever results I gave, even my students should be able to produce. So our homeopathy is so powerful and so dynamic that even a first year student should understand, and it should be so easily graspable by them that they have the confidence to practice homeopathy and have the confidence to treat the incurable cases. So here again, I'm sharing through my experiences of homeopathy how to understand real art of dealing the cases of rheumatoid arthritis. So in aphorism number 3, we cannot begin the cure process without the knowledge of the disease. And as you all know, it's the way of my presentation that I always take the disease part, understand the physical body, because the vital force which is disturbed, the vital force which is disturbed by the inimical forces is able to express himself with the help of signs and symptoms, that is totality of symptoms which we say, and that is well mentioned in aphorism number 9, 10 and 11 when he talks about the vital force. So everything which is visible externally is only through the signs and symptoms which the disease can produce. So if we don't understand what are the common symptoms of the disease, we won't be able to understand the uncommon. So we won't be able to give the cure. This is what Hahnemann sir asked. This is the basic knowledge which we should have while dealing with these cases. So here the knowledge of disease implies that we are talking about not only the knowledge of disease per the sense of the tissues which are affected, the disease, the journey of the disease, the course of the disease. Keep right now when the patient has come to you, what is the exact stage of the disease which the patient has come to you, and what are the expectations which the patient has come to you. So when we are dealing with rheumatoid arthritis, when we are dealing with autoimmune diseases, when we are dealing with any disease with lot of structural changes, as we all know, Sora is the beginning or mother of all chronic diseases. And as the year passes, Sora gets converted into psychosis and evolves into syphilis. But this syphilitic defense of the body is in order to save the whole organism, and it produces a total destruction of the certain parts and develop faulty organic alterations here and there. What does this mean? That during the course of the complete disease, the disease goes from the physiological phase to a pathological adaptation, what we say psychosis, going into a complete destruction where there are structural changes which can be observed at the tissue level, which are actually can be irreversible. Till they are reversible structural changes, we term it as psychosis, or somewhere the destruction has not yet come. But after the continuous chronic inflammation which is going on inside the body adapts itself and tries to compromise at the tissue level by altering itself through certain changes like fibrosis, like calcification, degeneration, and the process where the whole structure gets altered. But the whole mission of this vital force is that though the body gets crippled internally or externally, but the whole organism needs to be preserved and from this complete destruction of the life, so that the hostile assaults of such destructive forces just affect those weak end organs which are already being damaged rather than affecting the whole organism. So how it happens, let's see. So as we all know, Sora is the beginning of all chronic diseases, and we know that all the acute diseases, they fall into the zone of Sora. When we see syphilis, when we see psychosis, there are diseases, those are soropsychotic, there are diseases, those are sorosyphilitic also. But as the syphilis advances, as the structural changes or the tissue changes go on giving a complete destruction, a complete irreversible damage to the tissue, what happens? This disease goes into adaptation, but this syphilitic defense is mind well, as a miasm is different and as a defense is very different. Let's take an example. For us, as we all know, according to the Maslow theory, for the existence, for the survival, nutrition, respiration, and air what we breathe, the water we take, the food we eat, that is all the primary need, and we need it for our survival. But as we grow ahead, as we go on, we want that our family should enlarge, our generation should take over whatever intellectual experiences we had in our life, and because of which I should divide. But definitely, there are hostile forces which are around us who are just trying to hit us or trying to offend us. So, as a primary defense, as a syphilis, there is a beautiful immune response. What we say in see in the form of inflammation at the level of chronic or in acute diseases. And this inflammation, the primary aim of this inflammation is to protect the body from getting crippled. As we all know, there is continuous process of phagocytosis going on. The neutrophils are already in action. The lymphocytes are working somewhere inside the body. Until our immunity is very strong, these hostile forces cannot cripple you. But if the immunity goes weak, these dynamic forces will definitely affect the health of the individual, giving rise to an irreversible pathology, nothing but a destruction, what we called as syphilis. A very short, brief brush up of the basics of theory of miasmation given by Dr. Prafull Vijayakar sir. Let's go ahead by understanding our today's topic, and our main aim is to understand the disease that is polyarthritis, rheumatoid arthritis. We all know, I'm not here to teach you what rheumatoid arthritis is, because we all know it's an autoimmune disease which affects the joints, beginning with symptoms of stiffness, pain, swelling, fever, usually affecting the females, and it is differentiated from osteoarthritis in a very different way. So definitely, as we all see here, that rheumatoid arthritis is the inflammatory process which happens at the joint level. So what is the tissue? Is it the bone, or is it the joint cavity, or is it something else where the rheumatoid arthritis gets affected? So let's go and understand, because if we don't know what tissue is affected, we won't be able to select a perfect simillimum, because Hahnemann sir has rightly said in the aphorisms, the pathognomic power of the remedy should be well understood. Then only the proper tissue, the proper disease will be handled in a proper way. So when you talk about rheumatoid arthritis or any polyarthritis, it is not the bone, but it is the synovial joints, which is the tissue being affected because of rheumatoid arthritis. So the key function of these synovial joints, because they are the target organs or the target tissue of the disease. So the key function, let's understand, key if the tissue is affected because of the whole syphilitic defense which is happening over there as a miasm, what compromise we will have in the later half. So wherever, first understand the seat of the disease, that is the tissue. Every structure has got its function, and without any function, there is not a single cell which is running in the body. Similarly, these synovial joints, which are there in all over the body, they help us. Is the first function is that they have got a synovial membrane which helps in the movement of the joint. As we all know, when the evolution started, when the dermis, epidermis, ectoderm, neuroectoderm, mesoderm, mesothelium, they all came into existence. The dermatomes came into existence. Structure to the whole body, we needed this whole system of bones came into play. Initially, they were soft calcium like we see in shells and all. The initial thing was to protect. Then the need arise was to mobilize. So if we have to mobilize, just imagine that if we have a firm structure, then we will be able to make a proper movement. But again, if we did not have these joints and we just had a rigid structure which was just straight enough without having any joint movement, the movement was impossible. So therefore, as an evolution, this whole structure of joints came up. But equally, these joints, these bone, and these tissues of the body which fall under the category of the mesothelium, or known as the structure, that is the dermatomes or the myotomes, what we say, they gave rise to the bones and the tissues which help in giving the structure, that is the dignity, what we say, the framework. We get an identity when we stand erect. We get an identity when we have a certain framework. Otherwise, we are not having any structure as such without this framework. So this framework is very important. But this framework, if doesn't have any joint, into it, the movements, the fine movements of the body will not be achieved. So this human being, this body, whose higher purpose of existence have to be attained. So we need to perform so many functions, and these functions are only possible when these bones, they join together and they function together in unanimity and in informity with each other. There is some relationship between one joint and the other joint, and this joint cavity tries to bind this joint with the help of ligaments, with the help of muscles. The meniscus, which is there in between, it helps so that there is no friction between the joints, and this joint cavity is filled with synovial fluid. So this synovial fluid gives a lubrication to the whole articular cartilage. So the bone ends, they unite together, they function together. So when you talk about joints, it is something related to relationship in between the two bones. And the synovial fluid, if it is very good, the lubrication is very good, the joint will perform very efficiently without the friction, without the inflammation, and without any pain. So there is harmony into relationship. So another function is because it has got a meniscus, or it has also got a joint capsule where the fluid and cartilage like cushion is there, and because of which, whenever, like in the vertebral column also, there are so many intervertebral discs which are located, so they just absorb the shock, the friction, the jerks, the mechanical injuries what we have. So all these shock absorbers are because of these synovial joints. So because of it, because the fluid and cartilage cushion are functioning so well, the movement is very fluent and the movement is very good, so that we can perform so range of functions at a time. See, if even with a thumb, it gives a fine grip. This small little finger gives such a beautiful movement that we are able to write down, we are able to work efficiently. So all this is possible when these joints are lubricated, when the two bone ends are functioning as a union with each other in harmony. And it also provides its nutrition and also waste removal. So how does it act? So this synovial membrane performs a very important function in the synovial joint. As you all know, if there is Sora, that is primary inflammation, there is psychosis, there is also syphilis, that is the primary defense of protection. So everywhere in the body, we have certain defense mechanism, like the alveoli cells which are present in the lung, which secrete the surfactant, which also helps in the alveoli cell 1, 2 as a defense mechanism in the lungs. Similarly, in our joint tissues also, this synovial fluid has got the inflammatory cell which keep on protecting our whole joint cavity, and that process of inflammation and the process of regeneration, I will say, and replenishing the old cells with the new cell. There is a continuous process going on. But as we all know that this process of self-defense is very important, and when this gets disrupted, the disease process starts. But to give a complete understanding, the whole function of this synovial joint is to give stability and movement. So the joint capsule, the ligaments, they all are there to give a stability and movement to the joint. So when you talk about diseases, so if you talk about osteoarthritis, the disease osteoarthritis is not the disease of this synovial membrane. It is because of the degeneration which is taking at the bone level. And if you talk about diseases or injuries which frequently happen, like knee injury, the ligaments, the joint cavity has also got the muscles and the tendons which bind together the joint cavity. So these ligaments and these capsules, they hold the bone together. So the conflict at the level of ligament and the muscle will definitely be different than at the bone level. So if you have a fracture of a bone, the conflict, when you talk about a synovial joint, when you talk about the synovial membrane, the primary difference or the primary function of synovial membrane, if gets affected, the diseases will definitely be different. Here, there will be a difference into devaluation which is there at the level of bone, at the level of tendon, at the level of joint cavity, at the level of synovial membrane. We will see it ahead. So, as we know, this joint cavity, the synovial fluid has got a defense also. In healthy state, these monocytes, dendritic cells, neutrophils, natural killer cells, or the innate lymphoid cells which are present, they are all working in harmony to prevent the joint. They don't cause any destruction so that the function is compromised, so that the destruction is so gross that the tissue loses its own structure. So in healthy state, this balance is maintained and the whole inflammatory process is kept under check and at balanced tissue. But when the disease starts, any inflammation starts, like even we see in arthritic cases, like we had last year chikungunya, we see so many cases which come up with post-viral arthritis, polyarthritis, those all cases where this inflammatory process just hits the joint cavity and there is inflammation which starts. And we see that the CRP raises, the ESR rises up, and the neutrophils are high. The neutrophils try to win the battle first, but when they are not able to win the battle, the acute inflammation shifts to chronic one. So the monocyte and macrophages, they come into play. This is an indication that these neutrophils give the charge to the leukocytes, that is white blood cells, saying that now I cannot overcome this acute inflammation. So I want the monocytes or the macrophages to come into play and just defend the whole process and fight with those resistant power. But what happens? These natural killer cells and monocytes and macrophages, they come into play. They try to again stop this inflammatory process. But this ongoing stress, this ongoing process of inflammation doesn't stops over here. And there is an impulse to the body that now there is something which is really dangerous and I am failing here to overcome this dangerous or inimical life force. So now I want something more powerful to come into play. And that something more powerful is nothing but your T cells and the B lymphocytes, which come into play to fight against this most powerful inimical force. So, as we know, when this process of B cell and T cells, they are all involved in the process of autoimmunity, rheumatoid factor, which is one of the most essential key, I should say, in the whole process of rheumatoid arthritis. We should understand there is a process of antigen antibody reaction, and because this is somewhere this FC portion of IgG, that is what the antibody gets united to this rheumatoid factor. And what happens in rheumatoid arthritis is these rheumatoid factors which combine with the B lymphocytes and the plasma cells. So what happens is they are just the labels. Rheumatoid factors are the labels, I would say that they just go and stick to certain tissues of the body, right? They have got a certain affinity to attack certain tissues and cells of the body. So most prominently, it affects your body tissues are the synovial membrane or the synovial membrane of the joint. So you need to understand what happens as the immunity starts, why we call it as an autoimmunity, and what exactly autoimmunity is. So these rheumatoid factor which gets activated in rheumatoid arthritis, what they do is they just go and stick to certain tissues of the body, and what happens is this autoimmunity gets triggered now. So what is autoimmunity? So autoimmunity is like, as you see in this figure, the dragon is eating its own tail, right? So that capacity of an individual, I will never kill or destroy my own cells, because when I was born, my T cell were labeled at the time of birth itself. This is mine and this is not mine. So all the tissues of your body were so beautifully labeled when you took the first breath. This process happens just immediately before the birth area, just immediately before the birth takes it. So you can recognize your own cell. So the immunity that is fighting against the other offensive forces just tries to prevent your own cell. But in autoimmunity, it loses the self and non-self. So loses that identity, and therefore this is mine. They forget and they try to kill their own cells. This is nothing but autoimmunity. So what happens is these antibodies, which we call as rheumatoid factor, they just go and deposit over few cells of the body of affinity. That is what tissue affinity we say, to the synovial membrane, or certain like eyes where we have some external rheumatoid features also. So these B cell and macrophages, they try to form and fight this battle against the host. But in this battle of autoimmunity, the whole thing is that we are compromising our own tissues, and the osteoclastic activity, that is bone destruction, is more than the bone remodeling. And therefore, the whole destruction process goes on and on, and there is no stoppage to it. And the pannus formation, which happen, is nothing but the destruction of the whole joint cavity. And this whole process, where the rheumatoid factor is being identified as the hostile agent by the B cells and the T lymphocytes, and therefore this process never stops. And therefore, rheumatoid arthritis, if you will see the cure to rheumatoid arthritis, the books say that there is no cure to rheumatoid arthritis. You cannot prevent the ongoing degenerative process once it has, the trigger has come up. And therefore, in autoimmune diseases, they give lot of immunomodulators, what we say, where they just try to suppress this whole immunity, which is fighting against the host and can be even life-threatening. This same thing we saw when we see other autoimmune diseases. There are almost more than 100 autoimmune diseases which can be identified on the basis of different factors. So when you see rheumatoid arthritis, we see these RA factors go very high. Like it can go more than 500 also, when the whole inflammation is at that powerful phase, or when the body is really fighting, there is a battle which is going on, and those rheumatoid factors, they become very activated, and therefore you have a raised RA factor, you have a raised CRP also, because this inflammatory process brings up lot of inflammatory markers like cytokine, and other ESR also goes high. This is all about autoimmunity. So this is an hostile defense against your own self. You lose that identity कि I am more important in life, and I leave. Most of the cases you will see what is happening over here is your own body defense is killing your own cell. So therefore, the destructive process is against you himself. So they lose that. Therefore, we take rubrics like death desire, death conviction, death thoughts of suicidal thoughts. Why? Isn't this suicide that you are eating your own cells? Whole process of apoptosis begins because this is a self-generated death mechanism which gets activated because of autoimmunity. So therefore, in autoimmune diseases, you will see more rubrics being targeted towards cell. It is like, because this whole process of any autoimmune disease which starts at the level of inflammation, but this inflammation which goes on out of control leads to complete destruction and deformity. So therefore, any autoimmune disease we need to understand has to go through this process where they just stop at the level when there is real tissue left behind. They will completely eat up the whole tissue, the whole joint cavity, until the destruction is so much that the pathology goes into structural irreversibility. And I will tell you, key with the help of further examples also, that you will understand during the journey of disease how the symptoms come up, and when this destruction leads to the complete irreversibility, the joint which was so painful, the joint which was so lot of congestion, when it loses its identity of and loses its whole function, becomes painless, and it loses its function, becomes so rigid and so stiff that they don't perform the functions which were they made for. So this is irreversibility, destruction, and this is nothing but what we say is syphilis, right? So let's go and understand now what Hahnemann sir has to say about this autoimmunity. So in 216 aphorism, he has very well mentioned that this is a state of insanity or mania where the autoimmunity cells, they go insane, they go mad, and they are just running behind with that madness, and they just lose the capacity to discriminate between the own cells, and there is complete destruction which is there, and the physician has to understand the whole disease process if he wants to halt this autoimmunity. So if you see, one-sided diseases, they are termed as one-sided diseases because the tissue has gone into some structural derangement, and all the symptoms are more prominently of the disease symptoms rather than the original psoric symptoms, which they just are not present. So Dr. Prafull Vijayakar sir has beautifully correlated autoimmunity, saying that it is nothing but insanity at the cellular level. And he says, when you are treating such diseases, you need to be very precautious and just understand how these one-sided diseases need to be treated before you enter into rheumatoid arthritis, or you need to understand what happens exactly when this destruction is going on. So this is what we understand. B cells and T lymphocytes, they just go mad behind rheumatoid factor, and they just identify, kill it. They cannot discriminate between this is my cell or my other cell. So one and the other, that indiscrimination. So therefore, Sir says that this is one-sided disease and also termed as insanity. So now understand also what Sir has to say about syphilis. So Sir says that there are 7 layers of syphilis. What happens when you see exaggeration, distortion? So what is exaggeration? So exaggeration is when the syphilis is still at a primary level, the Sora is very prominent. You will see here that there were exaggerated senses of an individual. So still Sora is there. You have a vision, but the vision is very acute. You have a sense of hearing, but that hearing goes very acute. All the extrasensory perceptions of an individual, they all fall into exaggeration syphilis. Then you have distortion, is where you don't see what it has to be, right? Still, Sora is present over here. You see the image, but the image is distorted, like the delusions that a rope is seen as a snake, right? But rope is still there. So here also Sora present. Then perversion or hysteria, what we say, this is also where there are, like, the category comes up with the perverted thoughts, like getting attracted towards the same sex, right? So this is also perversion because there is no productivity, it is against the nature law. It is against the law of nature and the 26th aphorism, what we say, where we see perversion coming up. Then hysteria is something like something is very haywire means there is no speed, there is no proportion, there is no direction, and there is nothing which you will say can be logically explained. The cell, the tissue goes in an haywire and erratic mode that you don't control them. This is exactly hysteria. But what happens in destruction? So, as we have seen, all the syphilitic diseases where there is irreversibility at the structural level, they go into destruction. Last time also, when we see the diseases like fibroid also, we saw lumbar spondylosis, you see knee osteoarthritis. So all these degenerative process, this destructive process, they bring up the tissue at now the Sora has vanished, right? Which was present as sorosyphilitic. Now here you will see that soric mode has gone and the adaptation is so much that it has led to irreversible tissue pathology leading to destruction can be not be handled with only antisoric. You need a specific tissue remedy also to help this destructive process to be reversed back. Now, interesting, as we move ahead to the sixth and the seventh layer of the syphilis, the sixth layer is autoimmunity, where the cell loses the identity of the own cell. And the seventh is mind of the cell. What is nothing but the genetic mutation, the cases where the Sora is vanished, where we see the cancer cases, where the cell has gone into that madness that it multiplies like anything, destroying the whole mechanism of the body. So, when you're talking about rheumatoid arthritis, you're talking about this destruction. So, we have seen, right? We are able to correlate why now this becomes so important to us to understand the whole pathology, what we are dealing with. And also, we will understand that as per the stages of rheumatoid arthritis, can this work wonders to us? How it can work wonders to us? So, when you see the cases at very initial phase, this is the phase where even the RA factor might not be identified by the person, and you see that they have a healthy joint cavity. Initial phase where there is just a phase of fever and the patient says he mild, I can feel some pains here and there in the body, but still it is manageable. But then the process goes from inflammation, from an acute inflammatory phase going into a chronicity. A chronicity means a chronic inflammation sets in, and this is the place where the neutrophils hand over their work to the lymphocytes, to the macrophages. Now I cannot take the role. So you go ahead. So now the osteoporosis begins. There is subchondral bone destruction and the joint deformity is still not there in the stage 2. And the cartilage and bone, they go into deformity in stage 3. And there is a permanent ankylosis. See now, when it was in the first stage, still you had that structure of the tissue, and eventually as the disease progresses, the whole structure is lost. So how can they function so well? So the function is also completely destroyed. So this is the phase from the inflammation leading to the syphilitic destruction, that is irreversible pathological changes. Now understand how we can correlate this with what the books of pathology or books of medicine have to say. So when we say autoimmune triggered, so we are talking about these rheumatoid factors which are responsible, and we see it is running in families. So because of this, we see that lot of RA cases, they have a strong family history of rheumatoid arthritis in the family. Even in ankylosing spondylosis, history of rheumatoid arthritis in the family. Even in ankylosing spondylosis, when you see HLA-B27 getting positive, ANA coming positive, so you have a strong predisposition of these tissues being getting attacked through those factors. Everyone will not get affected. So this again describes you that the aphorism number 31 and 32, when you talk about susceptibility of the individual, that right seed, right soil, and the right season. So here the seed is being giving that stimulus that you have to forget the identity of your own cell. So this is where the inflammation begins. At the initial phases, there is my joint pain. That is what we saw. What happens at the synovial membrane? So there is synovitis, that is inflammation, and this is the target tissue or the organ of the cell, that is synovial membrane. So you have so many remedies in your materia medica. If you will go and see the rubric inflammation chronic synovium, where you will see Rustock's coming 3 mark. So this is the pathognomic understanding of the disease, what target tissue or the tissue affinity. And this is very important when you go into advanced cases where the inflammation has reached to the structural irreversibility, I will say. Then the pannus formation. So pannus formation is because of that chronic inflammation. And once the pannus forms, so you will see those joints become boggy. There is lot of swelling in the joint cavity and they get restricted. So there is, then the disease goes into the cartilage of the joint which is present. That cartilage also, because of the enzymes, they go into destruction and the joint space which was there gets reduced. So definitely if the cartilage is destroyed, the person will have problem in movement, right? So if the person says it was there, the pain was there before, but now, doctor, I'm not able to move it to a certain degree above now. It is so painful that I cannot do it, right? So now the structural reversibility has started moving towards more destruction process. And if the joint movement has reduced, that means syphilis has really gone ahead. From here, you have to please be attentive and alert, because if the person says कि morning में stiffness था, doctor, my hand has stopped moving. So this is a wrong direction, right? You should not, if the function is hampered, matlab your remedy is wrong. So you have to be so attentive. If patient says कि my hand, this was so good before, now it has become so boggy, I cannot hold a single pen in my hand, because this should not happen when you are treating these cases. And when this tissue destruction goes to the erosion level, right? When this osteoclastic activity is so far ahead that the joint loses its own structure, it becomes unstable, it becomes the reduced grip strength. So the function of the joint was flexibility, right? To move. So that flexibility is gone. That movement is lost now, and they become immobile, right? And again, this madness and this insanity of the cell and the tissue, which is not stopping at this level, brings us a permanent fibrous tissue gets deposited just to heal it permanently and restrict this joint inflammation to the joint level, leading to a fixed deformity or loss of function. So there are so severe pains. This is very late stage. But when this late stage goes ahead, the pain which was very vast goes into the state of helplessness and the joints lose its capacity. So this is the last stage where the whole destruction process has settled in. So this is the stage of the chronic inflammation, aphorism number 72, where Sir says that it is crippled the organ, the tissue, and the damage is so much that now nothing is there. but still the primary function is to prevent the vital force and the tissue from the whole organism has to be prevented. So definitely there will be certain systemic involvement also. So you see there is weight loss, there is lung fibrosis, pericardial pain. All these are because the circulating immune complexes, they are mad and they fail to identify as an autoimmune disease that this is me and this is mine, right? Okay. So now how we will see it in cases. I will show you. Be with me. I'm taking to you a evolution of two cases at a time, and we will see how the mind plays an important role and then correlate it to the mind level. So you understood that this was a case of rheumatoid arthritis. This is a female who had come to me at the age of 54 years when she was brought to me, and she was brought to me in the month of September, October last year. So that time the RA factor was more than 500. When it was recorded, it was 186, but when she was brought to me, it was almost 200 or something above. So the both the knees are being affected. The interphalangeal joints were more painful, and as you see, that she said कि my pain started from my wrist joint and then my both the knee joint became stuck up. Now my interphalangeal joints are swollen and boggy and I can hardly walk. I need some support. The pains are more when it is cloudy weather or when it is rainy weather. I am scared. Even my mother-in-law would say me that don't go, you will get locked. Don't bet yourself, otherwise you won't be able to move. So in life history, you will see that this lady belonged to a family which was a very lower middle class, but a very well-to-do family as the moral values were concerned. Father was a farmer, but very strong person who has bonded the whole family together. And he was very responsible. Whatever he could do for the family as a farmer, he took over the responsibility. So she said, Ki my family life was always good. We didn't have money, but we had lot of love and gratitude, which was always there, and the bond was very strong. So as a girl, I was very introvert, a girl from a mediocre family, from a poor family, but I was very happy-go-lucky girl, an introvert, but still very obedient and never demanded anything from my father. I would just adjust with whatever I had in my family. And I had good relations with everyone. You will be surprised that my mother-in-law was so caring towards me and affectionate towards me. She would always say, Ki, I want your daughter-in-law should take care of you as you did towards me. And she always played that good role of a mother in my family. So my father-in-law would always expect me that because my mother-in-law and we are from such a family background, you should take up all the responsibilities very well. But everything shattered when my father-in-law passed away, and he's passed away suddenly. At that time, we had a brother-in-law which was younger. So we had to take the responsibility, right? And my father would always pressurize me, saying that as I did in my life, now you also have to take the responsibility in your life, whatever you can do. So we asked my brother-in-law to complete his education into pharmacy, and I took over that I will go into the farms and the fields and work day in day night so that you can take up your studies. So you don't understand. Then she said ki we had very good bond amongst the co-sisters, and even her child, her son, would not recognize who is the mother of the child, and he would always call me as his own mother. That was the bond we had in the family, right? So it was like throughout the life I was taking up these all responsibilities, and everything was so important for me. But more important thing is I never complained about anything to anyone. I never showed disrespect to anyone. And I always took over the responsibility very well. I was only stressed out that one should ever say that I could not take up the responsibility and I was falling short of any duties which are supposed to be handled properly. So the person says ki during doctor, when I inquired to the son, and the son said, ma'am, the patient is really very obedient and very calm and quiet disposition, and she would never complain anything even during these pains. She becomes restless because of the pain and just moves around, but she will never express her anger and irritability on anyone. She says ki I always pray to God that I don't know what wrong have I done that I'm suffering in my life, and why am I being punished of this? I never understood. Doctor, can you tell me ki what mistake I have done? I had been such an obedient child since childhood and still I'm suffering. And I don't understand what is the mistake of my life that I am being punished in such a way that I cannot even do anything for my family. And whenever I talk to her, she's very mild and very smiling lady and who adjusts with whatever situations are. Then she said, Ki, I just keep on working also. It's very good and I'm blessed that I'm in a joint family and my co-sister takes place all the responsibility so well, but still I take that responsibility ki at least I should go to the kitchen and help her in the daily course. So she's very responsible female. Now, this is case one. Now we are going towards case two. So just understand the evolutions now. This was a case of a lady. Now this is a case of a male person whose RA was more than 500 when he was brought to me. Can you imagine? I don't have his reports, otherwise I would have shown you the reports. So the shoulder pain, which was right pain, was restricted. In the female, what we saw was left side being affected, right? And in the whole history, we can see that the family, the relationship, my children, my family, it is more important. So when it comes to the family part, you see the left side of the body is getting more affected, right? She's more care and worried about the family. Now, this is a male who is working as a professional, right? He's working in a shop as a person who is collecting the cash. So he came up with a restricted movement in the right shoulder and swelling and congestion of the interphalangeal joint. The ASO titer, which was very high, that is 105.8, and it is really very high. And in the past also, he had some syphilitic ailment because of some drug allergy where he had developed ulcers around the mouth. And can you imagine that he was the eldest sibling of the family? And since the early childhood, he felt that need that he should support his family, his sibling, and he should do the job. And he quit his education so that he can give education to his sibling. So he was so responsible and he was so work oriented and industrious since early childhood. He was also introvert and he would always say ki I always performed well. I gave my 100%. But if anyone points out a mistake to me, I'm really not able to tolerate because I know that intentionally I have not done anything wrong. And I'm a very conscientious person and I see to it कि मैं भूखा रह जाऊंगा, but I will not let my family members to compromise on any level. So as he is the eldest, have to behave calmly. He cannot express his anger because he says if I express my anger, others will also behave the same. So I have to behave as a dignified person in the family because I'm the bread owner in the family, the eldest person. I have been very intelligent and ambitious. But doctor, after my 12th, I realized that if I invest into my education, I would not be able to give money to my siblings. I even tried to earn through a business, but there was a huge loss in the business, and therefore I selected to continue the job which I am still into it. So I have to work for my whole family throughout the life. I've never done anything else in my life. Now I have a single daughter. I'm worried for her because she's not ready to get married. And now my age has come up that she should really get settled in her life. I don't like taking loans, so I'm really worried about the financial issues. And ma'am, the real thought is I really want to die earlier and I don't want to get dependent on my children because who will take care of me? I took care of everyone. I don't want to be a burden for the others. So better to die early. never gave importance to relationship in my life, and therefore relationships are more important to me than the money, and therefore I compromised myself beyond the relationship. I always struggled financially but never asked any help from the others. There was an incident which he shared that he is a person who collects money from, he's working in a firm which is dealing with wholesale department, and his job is to go here and there and collect money. And he said ki I was the person responsible for the cash, and since last 20 years I'm working in the same firm and not a single penny was here and there. And this incident took place that there was a loss, there was a difference of 50,000 rupees in the cash which was deposited at that time. And I was like, my boss's son, who was very new to the business, he really tried to humiliate. He did not understand my importance, and he was blaming me that I took the money. Ma'am, how can I take that one thing upon me? I was a person who has lived whole life with so much of dignity, and I've compromised myself. Then how can I do this? So I started blaming myself, and that guilt that this is the wrong thing which I have done. And I kept on crying for 2 to 3 days till the matter was solved. And it took almost a month, and I was like, yeah, I will leave the job, but will never take the blame of the mistake which I have not committed. I'm ready to fight it. But I know ki I cannot fight. I'm too, because I'm not financially so great that I can fight with the authority. So I blame upon me. And but still I did not accept. And over a period of 15 days, the whole matter was resolved. They could get into the calculations, and they realized it was not my mistake. And the boss really apologized. But those 15 days, ma'am, I cannot describe. It was like I should go and commit suicide rather than living this life where it was a guilt on my shoulders. And I tell you, the fever started the same time period when this blame and everything was going on. I could hardly eat anything. I lost my weight because of all these things, and the whole blame came upon me. But that feeling always is there with me that I did not commit a mistake, so why I am being punished for something. So this is what you will see in two cases. So what Hahnemann sir says, ki there has to be a certain imagination, which is we call as delusion, or that thought process which is sufficient enough to cause an incurable disease also, and disturbance of the vital force can be because of that cause. So in two cases we saw, first there was certain, definitely a lot of burden of responsibility, and there was a feeling that I have to take over everything whatever I have done. And in the second thing, there is also a lot of burden of criticism, that how I can be blamed, right? So these thought process can be taken at the level of delusion. Now understand, come back to the pathology. So rheumatoid arthritis. So when we saw the tissue of rheumatoid arthritis, we saw that when the disease process is progressing at the tissue level, when the disease started from inflammation going towards the structural irreversibility, what happened was the joint which supposed to give value to your whole constitution, that framework and that flexibility which the joint had to perform all the fine functions, right? But because of that whole pathology, which has led to irreversibility, had lost that flexibility and had lost that value system of the whole pathology, right? So when you talk about rheumatoid arthritis, you talk about undervaluation, you talk about inflexibility, anger for self, right? Anger which is targeted towards self, leading to autoimmunity. There is lot of stiffness, there is lot of inflammation, the muscle strains, the tendons, the ligaments, they get torn. So finally, this inflexibility which is there in the mind tells that I just want no one should now move because the life is so much stuck up कि I cannot take a single step or single movement in the life, and I feel that now there is no way out to escape in this life, right? So I feel that I'm being tied up to that level that I need to stop all my movements, leading to inflexibility and needing to that stiffness so much that the movement becomes so painful and that inflammation goes to that irreversible phase. So that lack of flexibility and that undervaluation is the reason that why this mesothelial tissue or the bone, rather than the bone, the joint cavity, the synovial membrane is getting affected, and because the anger which is targeting towards the self is getting affected. Now, we saw the two cases, right? Now, in these two cases, there are two situations we have seen. One case, there is left side affection. One case, there is right side affection. In one case, the problem started from the wrist. In the second case, the problem started from the shoulder. If you talk about that disease pathology same, then how individualization works. So this is where individualization works when you see the journey of disease of rheumatoid arthritis. So in cases, you have to understand how it functions, where you need to identify where the patient is blaming herself, where that devaluation had started, where that autoimmunity had started, that the person starts blaming and offending that knife, that gun is towards the self. Why? Because we saw it is autoimmunity, it is madness where you fail to recognize your own self. So, where the person is reproaching himself, where there is anger which is targeted towards the self, where there is any guilt, because a guilt at the emotional level, if you see the map of consciousness, if you will see the map of emotions, you will see guilt is the most syphilitic emotion which triggers the syphilis, or it is one of the person, because guilt is where you blame yourself, you feel that you are responsible for the whole situation which is happening in the life, right? So guilt is the most deadliest emotion. Therefore, when we practice Jainism, we practice spirituality, the most important thing which is given importance is gratitude and forgiveness. So when you are in that emotion of anger and guilt, you're not ready to forgive yourself. You are not ready to forgive the situation which is happening in your life. But if you start practicing gratitude and forgiveness, this guilt emotion goes down and you start loving yourself. So, therefore, this guilt is so important in all these autoimmune cases, and you will see that this is the key you will see for all the cases, right? So, blaming self for whatever is happening around them, whatever happens, they will say, ki, I am responsible. If it rains heavily, my God, I am here, and therefore you all are stuck up. So, everywhere they will start finding a cause which is pointing towards them. And they will be always the person who will take the responsibility. Ki, I will make sure that no one should suffer because of me. And it is always that they will take the blame upon themselves that it was my mistake, right? They are always discontented with themselves, with their performance. They are the people who have that self contemptuous behavior or reproaching himself a behavior. So, all the thing of rheumatoid arthritis is revolving around the work, because this whole structural framework is responsible for giving a structure, taking up the responsibility for better performance. The joint cavity is there. For better relationship, the joint cavity is there. For better taking up the pressure or the friction, what we said, is this joint cavity responsible. So when you see all these things, right? When you see this whole picture, am I clear till now? And when you see ki the person who has been performing so well throughout his life, his target is only and only performance, is only work and nothing else, right? So when there is nothing else apart from the responsibility in the life, right? Still the person is more discontented with himself. He's de-appreciating himself. There is so much of discontented depreciation, and they don't love themselves. They lack that love and that appreciation that whatever they are doing, forget of. I always say, ki, if you won't love yourself, who else will love you, right? If you don't start appreciating whatever you have done at this level of time, no one else will do. So everything starts from yourself, right? And if you don't appreciate, others are ready to criticize you, right? So he feels that something he has done is very wrong. They are very rigorous people. They are very workaholic, industrious people, because joint function is to perform, right? Joint is there to give a smooth movement between two bones, right? So they has to be industriousness. They have to be people who are very firm into the decisions. They are very obstinate and very ambitious, and they will see, you will see that stubbornness, that inflexibility and obstinacy comes because of that stubbornness. They're perfectionist people because they cannot trust others. They are like, you will see Rustox, the most superstitious remedy of a remedy brew is stocks, because they don't trust others. They want to do everything by themselves. They're so perfectionist. You see arsenic, they're so restless people because they cannot trust others. They want things to be done in a proper way according to what principles they have laid upon, and anything goes above them. They are obsessed with their thoughts. They cannot adjust and adapt to the changes, and therefore because of the thought which goes imbibing into them, they start compromising themselves. Even if they are tired, they are sick, they keep on working. They are on the edge of that work, making them more restless, more industrious, because they don't want to rest. This is what we should understand. When self-sacrificing behavior is because they cannot tolerate, self-sacrificing behavior becomes more injurious to themselves because it is autoimmunity, right? So this needs to be checked up and this needs to be understood. Now, as we go and understand the emotional pathology, we will see ki what tissue and joints are being affected. I will take the case number 1. So in case number 1, we saw that the wrist of the person was affected, the interphalangeal joints were more affected. So when you talk about these fingers, you talk about these hands, so how to understand them? So when you talk about this thumb, as you all know, this thumb, if you know, there was a practice which used to say, ki, just try to bend it. How much flexible you are and how much rigid you are, it tells about that flexibility. So when you talk about thumb, that is state of mind of joy and sadness. You don't want to get defeated. You don't want to bend, right? You want, this talks about that rigidity, and it's a thumbs up, right? When you give thumbs up means best of luck for whatever battle you are into, right? It's a best of luck sign saying that, yes, now you are in that winning spirit, right? You go ahead in your life and we wish you good luck, right? So it is related to that performance, right? That winning spirit which is there. So when a thumb of a person is being affected, it is like they feel unprotected and they feel that they cannot be happy, and that winning spirit goes off when that person is in front of them. Whatever, if it is left hand, it is related to that femininity or the mother conflict or someone related to the heart, family or something. But when it comes to the right hand, it is related to the partner business. That rule applies over you, right? But when you talk about a finger, right, a finger, this finger, when you talk about this finger, it is the finger which you point towards someone. So you want to blame someone, you want to give something, indicate something, like this finger comes up, you want to point it. But remind it, when you're pointing this finger ahead, the other fingers are pointing towards yourself, right? So there is someone in the family or in the vicinity who tries to infame you because it is pointing out your mistake. It is like you feel being discussed. Like वो बोलते हैं ना, जब उंगली सीधी उंगली से घी नहीं निकलता तो उंगली टेढ़ी करके निकाल लो. सो दिस फिंगर indicates that टेढ़ी करना. So something which is not done in a right way, you feel that disgust feel. Then this middle finger, if you have seen WWF, if you will see aggressive things, so they want to show that anger in that rage, they just raise their middle finger and fuck off. That is the thing what they say. Ki that anger and rage is there. So when you feel that anger, so you will see that rheumatoid arthritis, though it affects all the joints, but few fingers are more affected in that person, right? So they feel more anger is there. So that anger is more towards the middle finger. And this little ring finger. This ring finger is where you wear something, your engagement ring, when you feel that you are being engaged with someone, so you have a ring right in your hand. So it is about the union and bond between the two couples or someone related to your partner. So when you have issues at this ring finger, it can be a trigger finger also. So just you need to identify that you have a problem with someone related to your partner. And now this sweet little finger that is called as a pinky finger. This little finger is usually used to scratch ears, that's like that. But it is somewhere, it talks about your vanity and something which you want to show off, right? So when you are not able to keep that vanity or superficial image in the society, that time the conflicts they settle into the little finger, right? I had a case of psoriatic arthritis, and I would always wonder ki he would always complain about this. There was no destruction anywhere, but he would always complain that my this finger is really painful of both the hands. And I was like, I don't know why he's suffering, whatever the conflict is. Then later on, the wife came and said that he's a person who likes to be dressed very beautifully, and whenever he goes to the friends, he will see to it that he's well dressed. And every time he tries to be well dressed, but somewhere people criticize him. It hurts him, right? Because he's more conscious about what he's wearing and how he's looking to the world, right? Now, come to the wrist joint, right? And you also know ki this is Sora, this is psychosis, and this is related to, there is a saying in Marathi, Karagra Vaste Lakshmi, but it talks about the whole hand, and sir would always say that saying. And this joint of the wrist is actually the union where the whole hand is getting united with the radius and ulna. So it is important because it gives you that विष्णु का बोलते हैं ना, ये चक्र घुमाने का जो movement. And when a wrist of a person is getting affected, then it is like कि someone is doubting you that you are not good at this, and you feel that you are not good in performing at this level, and I am not worth what I must be. So you saw in our case also where that lady has given her whole life to the family, and when father-in-law passes away, though she had given everything about her whole life, she has compromised. She got married at 20 years of age and she has given everything to the life, and still father is somewhere telling and doubting her ki yaar dekh how I did whole life, now you take up the responsibility. So is it the doubt which my father is putting upon me? Do I feel that I won't be able to take up? That devaluation came up कि my father-in-law has passed away, but now I have that responsibility of my whole family. So am I worth of doing that responsibility? So that wrist joint comes up. Thank you. There is someone who has put on the chat box that Karagra Vaste Lakshmi, because you count money with these fingers, right? Karma Saraswati, you read book, and when you wake up in the morning, the whole family, the universe, my universe in that case was, what was the universe for that female was her own family. There was nothing else apart from the family. She has not even stepped out of the family because it is her responsibility, and whatever she has done is for the family. So the universe around me. So when I feel that I won't be able to do good and I'm not worth much about it and won't be able to, this whole tuning, and I won't be able to function so well. So this is what the wrist joints get involved. So when you're talking about rheumatoid arthritis, please see to it कि what finger is affected more, and you will see, yes, this is the more affected finger, and just take up and you will see where the syphilis of the mind has gone into it. Now, going ahead to another joint which we saw was the female was affected was with the knee joint, right? Even the male was being affected with the knee joint, and knee joint is also one of the most important synovial joint of the whole structure of your body or anatomy, which gives a lot of flexibility into the motion, right? So now, how will you understand a knee joint, right? When you talk about any inflammatory process at the level of knee joint, there are so many tissues which are there in a knee joint. There is a meniscus, there is a ligament, there is a tendon, there are bones which are getting united, there is a synovial membrane, and there is a synovial fluid which is there, and it is one of the largest joint, hip joint, knee joint. They are all labeled as large joints of the body, and knee joint has got the capacity to bear the whole weight. You will see that these days the knee joint is also responsible for bearing the weight. It was not there in years ago, 25 years ago. The knee arthritis used to be there after 60 years of age, and you would see that old people of 71, 72, they would sit on the ground, matlab, with the chairs at the temples and the places where we used to go. But now, the knees have become so weak that even early age people are going into osteoporosis and early degenerative changes and going into early knee replacement because of the early osteoarthritic activity which is relating to a syphilitic degenerative process but at a premature age. So what is happening is there is fear of responsibility which is very running up. People have become rigid. They don't want to be flexible. Before, people used to bend down. Pehle, when you used to bow down to touch the feet of the person, people would bow down to their knees, bend down, and then touch the feet and show the gratitude towards the person in front of which they were bowing down. But today, people's ego have become so vast that they're not ready to bend down. They have become so rigid that they feel ki we are the best, and they don't have that gratitude towards the teachers, towards the guru, or towards even the highest person in this life where people cannot perform anything, right? So there is great undervaluation in movement identity because knee joint is related to lot of dignity in your life, lot of value system to the whole constitution leading to flexibility. So essential flexibility role in a person's life. So when you see knee joint in rheumatoid arthritis or any polyarthritis, you will see inflexibility and undervaluation which is there. Again, when we are talking about a connective tissue, you're talking about bones, you're talking about, but if you talk about rheumatoid arthritis, the inflexibility steps in, marked up and stamps in, right? So that lack of flexibility regarding the person's mental pattern. Like, no, people before used to walk so miles ahead and they were so flexible. Okay, fine. If I'm not able to get this, I will be satisfied with whatever I'm having in my life. They were people who were really matlab, adapting to whatever circumstances in the life were. They were like, if you see so many cases before, the children were so adaptive. We had only one Natraj pencil. We never demanded another pencil. We had only one Reynolds pen as a company to use. We had we didn't have any choices, right? Being given by our parents. But still we had that flexibility that whatever life situation came up, we were ready to accept. But today, people are having so many choices and they are still rigid. No, I want this means I want this, and I won't survive if I don't get this. So they really end up abusing others also. And when you talk about autoimmunity, they start abusing themselves because they lack that flexibility or they lack that yieldingness which comes up. Then inflexibility with the ideas which we have seen in the form of rigidity. So they do not work for them, but still they want to persistently perform on that. They know I know कि this thing is not working for me, so they should be flexible enough. Oh, this job is not working for you, so please change it. This boss is not working fine, you can change it, right? You change your mindset. You get satisfied with whatever you were having. Our parents used to tell us, you have that gratitude, whatever is given to us, and don't look into the meals of what others are having, right? And be happy whatever meal this God has given to you. Pray and just have that gratitude. But now people lack that gratitude and they have become so fixed that no, if I want this means I want this. So they actually defy. Even small kids, they have become so defiant towards their parents that they just lose that thing and they just want what they want at this point of time. They don't respect. So they don't respect others. They don't respect themselves also, right? If you talk about rheumatoid arthritis, they forget valuing themselves. They feel that I am incapable of whatever I'm doing and I'm worthless of whatever I've done. The case number 2 of that male person, in spite of doing so much in life for the others, but at the end, what he said, I should die because I feel that I'm worthless of this job now. How can I take this blame upon myself? And I try to criticize myself for whatever deed has done, right? Similarly, that lady is feeling that worthlessness, that am I worthy of taking up the responsibility? Will I be able to cope it up? And what wrong I have done in this life that I'm suffering so much? So that worthlessness creeps inside the mind. Then they are unhappy with whatever they are doing. So they feel that incapability as a part of undervaluation, right? They are feeling worthlessness, they are incapable, and they force themselves to come up with another thing, and they just want to perform. See, knee is for runners, right? Knee, sartorius muscle, hip, they are for performance. You have to run. Always knock the knee. What we say is knock the knee and be that zealous person to perform, right? So they are the people who are not happy with their performance. They are not only disrespecting themselves, they are also to the level of autoimmunity. They start punishing themselves for whatever deeds they have done. And they say that it is being forced upon them to the level that I should suffer, and because I have done this mistake in my life, I have to suffer the whole punishment. And this is where that devaluation goes into inflexibility, that the delusion that I am done wrong in my life, I am a criminal, I am being doomed in my life and I have to suffer. The knees show humility, the acceptance of authority. I said na ki you bend down in front of the authority and show gratitude in front of God. But if you don't accept that humility and you become more authoritative, so you won't bend in front of others. So nowadays people have lost that gratitude attitude, and therefore lot many knee complaints are coming at an early age. So we must look for the person who are connected to their work, home, family, or place. Now, when you talk about the diabetes also, you have so many cases of arthritis also. But try to understand how the journey started. What was the first tissue which was affected? The conflict will lie upon that tissue only. If the journey had started from the right shoulder, the conflict has to start from the right shoulder. If the conflict started from the wrist joint, the conflict is near the wrist joint. So every tissue of the body, think forward, what you do is you apply the pressure with your hands. So the pressure with your hands is applied with the help of shoulder. So you want to push something ahead, something forward is projected in the future. So this is the shoulder which is responsible. If I have to throw something, then also I have to use my shoulder. So what happens is the person feels कि whatever the goal I have in my life is actually far beyond which I want to. मतलब मेरे हाथ, कानून के हाथ बहुत लंबे होते हैं, they say, right? So मेरा हाथ नहीं पहुंच. The person wants to go further than what is reasonable, right? I recently met with a person who had just got a shoulder pain and he got stuck up. Like the pain was so severe ki the movement was impossible. He is diabetic, having frozen shoulder. So I always asked ki what you wanted in life. So he said ki my family, my children are around me, but I feel that they have gone beyond my control. The children who used to be under my control, I feel that I cannot reach them. They don't understand my feelings and my emotions, what I have towards them, and they have started criticizing me. I was the person with so dignity in the society. Dignity in the society. And I was a person from a very small village. Now I am a CA, right? So he must be so ambitious, but he was very dogmatic, very harsh when he was handling his kids. So his kids had got that fear of approaching father, and he felt at this age कि now my family has gone away from me, and he suffered with left shoulder joint. So as the person is trying to attain something which is beyond his reach, which is not achievable, so the person feels that I am incapable. So that undervaluation creeps in, and he cannot reach that thing which he wants in his life. So he remained inflexible in his way of thinking, and he's very rigid. I am always the best person in my life. I am the best. He would always say, आपको क्या पता? That person, that CA, never had that fear of fighting with the authorities also. Now he is working on the desk of legislation of the CA firm, and he says कि I am fearless and I don't even have that fear of defying those seniors who are doing wrong. But I will never compromise on the values what I have. He's so rigid and he's firm. He said, ki, why you have to take a leave even on Diwali? I never take a leave. You should work. You are a doctor is meant to work day and day night. So how can you take a leave? So he's contemptuous, he's so stubborn, and he's so workaholic with the vision that he has to work day and day night. So all these functions come up is with a shoulder pain. I had that lady, one lady who came with lichen planus. Her husband is always criticizing in spite of doing the best thing in her life, that you don't work so well and efficient. So she's like, I always have the target in my life that at least once in my lifetime, I'm 74 right now, at least once my husband should appreciate for whatever things I have done for him. So I feel that I'm stuck up, that in spite of doing so well, my value is not there at home. So I feel that still I'm doing it. Still I'm consistently doing it and performing so that my husband should appreciate me. So this is what the shoulder came up. And here also, the person which we saw who came up with right shoulder, case number 2, what was there? He was being working from the age of 7 years, and the whole aim was not to build up the money or finances, but to build up the relationship. He quit his business because of financial loss, but he did not quit his boss. And what questioned was his whole dignity, and his whole year of service was at stake. So he could not take it. And he said, I was like, I tried to search each corner. How can I commit a mistake in my life? So I started devaluing and blaming myself, and that was performance. Again, a right shoulder came up, right? So this is how the shoulder came up in the patient. So this individualization, how even in rheumatoid arthritis, you can target, because the journey of disease started from which tissue, which organ, and now understand why synovial membrane, because it is, again, the person did not blame the boss son. The person blamed self, that how can I commit a mistake in this whole life, that I am being pointed. He felt embarrassed and humiliated, and to the level of mortification, right? So this is the correlation of the whole pathology to the tissue, to the organ targeted, and how it has gone into syphilis. You saw the RA factor was more than 500 in this patient. That means the inflammatory process was so syphilitic, so dynamic at that plane, that it was just stopping everything and freezing the whole shoulder, that now it is high time that you have given your life. Now He said, I want to die rather than getting dependent on others, right? So that is the dignity he had in his life. So when you talk about self-devaluation, when you talk, two terms we had for rheumatoid arthritis, one was self-devaluation, anger towards self, and inflexibility. So let's go and brush up few rubrics of self-devaluation. So the most important syphilitic rubric of self-devaluation is again criticizing self, reproaching self, but how to see other rubrics. Let's go on. So as I said, that devaluation comes through that emotion of guilt, which is the most dangerous in poking up the syphilis, that remorse feeling, the reproaching self, that I am responsible, I am at guilt of whatever the mistake I have done. So they are the people who are ambitious, they are performing in the whole life, they are workaholic, industrious, they contempt their own self because of that autoimmunity. So anger pointing toward self. They are discontented with themselves. So you saw that even after performing, he's blaming himself. That lady, even of performing so well, she is very sensitive that how father could criticize her and ask her that you have to do your best. She did not take it as a admonition, aggravation. We have a rubric, right, where the person cannot take a slightest suggestion also and it hurts her, because she said, keep for me whole life my father was idle, now I feel worthless, what did I do in my life, right? Am I incapable? I am a failure in my life, and in spite of giving so much in my life, I feel that I failed. So now convert these emotions into rubrics, right? So in case I am failure, fear of failure, delusion of failed, delusion doomed, delusion worthless, contemptuous towards self, reproaching himself, they all are the rubrics. Delusion, criminal he is, delusion, crime committed, delusion, despised by the people, delusion, worthless, delusion, neglected the duty, delusion, crime committed, criminal he is, delusion of being insulted, the honor wounded, the indignation feeling, the mortification leading to the suicidal thought. Then there are so many other rubrics leading to the desire, death conviction, unpardonable, inconsolable. Everything will come into this category. I have committed such a crime which cannot be pardoned by the God. Anxiety, salvation of will also come in this category, because they have the thought ki, I don't want to be dependent on the people, so better die early. I know ki I will freeze. I am so rigid in the mind that I will freeze. My joints will hardly move. So who will support me? So better I should die early. And because of that thought, rheumatoid arthritis patient, they have that fear of independence, fear of dependency, and that fear of future anxiety leads to that lungs tissue also getting involved. They cannot see themselves at what position they are, and therefore the eyes also they get affected as an extra joint affections of the life, right? Now, few rubrics for inflexibility, right? Inflexibility rubrics will be obstinacy, right? I am rigid, I am obstinate, I am inflexible, I am that I become so strong that I am worthy, I am capable, I can perform. But now I want to perform as per my rules. I am dogmatic and dominating person. I am obstinate to the rule that even if someone is saying, "Ki, please, this is not the way to do. You're punishing yourself." Still, I want to work and work even if I have pain. So their perseverance that is there in them, that haughtiness, that dogmatic behavior, that pertinacity, not leaving their position, that positiveness, yes, I will achieve something which is saw in shoulder, that I want to achieve something which is not attainable in my life, but I want to be consistent and I want to achieve it. They don't want any contradiction. I cannot take any criticism in my life. They are intolerant, not moved by apologies, undertaking things which are opposite to the will, right? They want to do many things in the life and want to achieve many things in the life. Yes, Then audacity can also come. If someone can suggest few more for rubrics, it is very welcomed. You can even put it in the group. This were the only few glimpses I could put up about inflexibility and rigidity which was there, and undervaluation conflicts which are there at the mind. At the tissue level, when you want to take the rubrics, you can take inflammation joint, inflammation rheumatic, inflammation joints deforming, inflammation synovitis, and there are so many rubrics like inflammation diagonal also there. When you see left hand and the right part is there, only one sided. I had a case where she would just come recently with one sided complaints only. She said ki my whole body of right side is stuck up, and other case, other time she will come up, now last week you gave the medicine, my right side was stuck up, now my left side I feel stuck up. So there are alternate locations also which are coming up. Then she would always complain ki my right shoulder is affected, at the same time my left knee joint gets affected. So you have diagonal position also of the pain, you have excruciating pain, you have pain qualities which can be taken up. Then the modalities, if they are very important, can be taken up for the prescription. So there are so many rubrics can be hunted up. This is the case of rheumatoid arthritis. I would like to take up the investigations before. So this is the day one when she was brought to us. After 1 month, this is there. She's on the bed and she's stuck up, and she said ki slightly she's better. Her joints, see swelling of the shoulder joint, elbows, hands. She sent a video of all because she was hardly able to move. You see the ankles, they are so swollen. There is so much of swelling that she could hardly walk. The son is into pharmacy, so he shares very beautifully. All her joints are swollen. This is the next follow-up where the swelling has markedly reduced. She is able to walk now without support. Before she would not walk without support. Then this is 6th month 2025. She says ki the swelling has reduced. Now she's able to walk in so well, and she can walk even for a long distance now. The swellings are very better and she's able to work. This is winter season, still her stiffness has gone and the swellings are gone. The video quality is not so good because it is being recorded by the patient. Now, what you expect when you talk about rheumatoid arthritis? See, the swelling has gone. You can observe that there is now no swelling. Even the joints have become very free. Now you will see the patient themselves. They gave us the report when she was brought to us in August 24. As I told you that the RA factor was more than 180. But after first follow-up, the RA factor, which is 170, then October when she was brought up, it is 290, what she said. And here the problem is key in the first prescription where the CRP 66.3, uric acid 4.4. What I made a mistake as a first prescription, I will tell you, is I gave her a remedy which was on the basis of her Sora. I gave her the first prescription from my side was that she's a timid lady and I'll read it from the totality. And I gave her the first, she's responsible towards her family and she's too timid, mild, yielding disposition. And she is like, she's always contented and all. And since work wise also, she's diligent and conscientious. And I gave her Ignatia, seeing that she's diligent and conscientious lady and working and so all. But I forgot to see what disease she's suffering and how to analyze that. See, if you are in the wrong track, your first remedy, immediately when you give a wrong remedy, the body will never leave you. In 4th October 24, right? When after the first follow-up, see, she was on vitamin B12, which were lower. Now it became hypervitaminosis. It's okay. We can understand that. But what about RA factor? The RA factor increased twofold almost, and the uric acid also increased, and the CRP had gone out of control. That means my remedy was wrong. That means my first prescription was definitely wrong. Then I again reviewed the whole totality, and what her son said ki maybe because vitamin B12 has come up and therefore she's not able to walk, and she could not come even for the case follow up because she was completely that day on the bed, and because the pains were so severe that she could hardly give a follow up. And her son only said, whatever medicines you could give, ma'am, it has not worked for my mother, and now she's bedridden, so you are at a faulty place now. So this stuck up my mind, and I was like, hey, something has gone wrong from my side. I did not consider some syphilitic trait because I just prescribed that she's mild, diligent, conscientious. Did I take syphilis? Did I understand what was the syphilitic pathology which was going on and the tissue affinity which was going on? And definitely committing a mistake, I reviewed the totality. I gave her a new remedy, and after that new remedy, again I could see that there was a gap because the son was too disappointed initially, so she could not get her to me for the follow-ups. But gradually we saw that with the medicine, the RA factor started coming down. And when this report came in March, so that time he brought her to me saying, now I am convinced that you are a right doctor and you have brought really a good result, and see the gradual decline in the RA factor. That means that insanity at the cellular level has reduced. This CRP is on and off fluctuating, right? So now how to understand these investigations also when you're dealing with RA? Yes. So when you are taking and understanding rheumatoid arthritis as the Hering's law of cure. So when you understand Hering's law of cure, definitely these investigations are very important. These investigations will give you a window that you are right or wrong. So if you see that if the autoimmunity marker is RA factor, so when you understand this case, the titer of RA factor becomes very important. RA positive and RA negative से ज़्यादा the titer is very important, right? So when you talk about ESR, which comes baseline, so elevated ESR is definitely an inflammatory marker, and it indicates that fibrinogen and the chronic inflammation is ongoing, right? So if still it is high, that means the disease is still at active or can flare up at any time. So if it is falling, that means it is a good prognosis. See, any disease, this chart should be there with you. You should know what pathological, biochemical investigations we do and how they help as understanding knowledge of disease and understanding the Hering's law of cure. From the investigation in all the diseases, you will understand कि autoimmune disease हो या कोई भी disease हो, these investigations are your friends. So don't say कि we are homeopaths, we don't understand any investigations and we don't need any investigation. If it is a case of simple tonsillitis, sets up into bronchitis, sets up into pneumonia, and now the patient has showing that sign of consolidation, you are wrong. So accept your faults. This helps you in treating the case because they are chronic diseases, right? Where the inflammation has gone out of your control. So these inflammatory markers will be the guideline कि you are in a right direction or not. So CRP is again acute phase protein, indicating that yes, there is an ongoing. If it is persistently high, that means there is some joint which is getting inflamed, because it is again an indicator of IL-6 and tuber necrosis factor alpha. Now rheumatoid factor, which is a specific antibody towards rheumatoid arthritis. So when you talk about ESR, CRP and RA, then RA factor becomes very important, because if it goes high, it will give you that definitely deformity has not stopped and the cellular insanity is continuing. Then anti-CCP, few cases you will see that RA factor is negative, but anti-CCP is positive. So they are called as seronegative rheumatic arthritis. Many cases I've seen that before RA comes positive, anti-CCP is positive. In many cases of polyarthritis, I've seen this anti-CCP is also a very fine marker, which is very high and showing you that. But yes, if RA factor is positive along with anti-CCP, those cases have got a high chance of irreversibility. Then hemoglobin, if you have given the remedy, like you have seen in this chart, in spite of giving vitamin B12, giving calcium supplements, still the hemoglobin had gone down. This is actually the Sora. So Sora is for survival. So yes, I agree that anemia of chronic disease is very common, right? But after your remedy, this hemoglobin should not fall down, because again it is an indication you are in a wrong phase, right? Then total counts. Yes, these total counts should not cross the limit of like 1700, 17,000, and this should not be the count. They should be definitely under control, and even you should not have leukopenia, that is very low lymphocyte count, because every time you will have very low lymphocyte count, that means your lymphocytes are being used up somewhere in the body for that chronic inflammation which is active there inside the body. So this total count is also very important. Then platelets, because platelets are the sign of healing, and they are there where thrombocytosis is there because of the inflammatory markers, and there the inflammation is very active, and platelets, they get involved into that inflammatory part. So if they are very high, that means inflammation is still ongoing. So even from the CBC report, you will understand that you are in the right direction or wrong direction. ANA positive, ANA negative. Yes, if it can be positive also, and it can be negative also in a case of RA. So don't stress upon ki this case ANA is positive. If it is positive, then this can be combined with other connective tissue disorders like what you say, SLE, S-Sjogren syndrome. I have a case of S-Sjogren syndrome, SLE, then scleroderma. So this RA can get combined with other autoimmune diseases also from that category. So ANA can be positive or can be negative. C3 and C4, usually I don't do it, but if patient do it and if it is very high, then please rule out the diseases of the vasculitis, or other systemic complications can step in, and they are really very important when you go for CD3 and CD4 cell count. If the patient is having that congestion, that pain, high grade fevers, and they are not settling even after the right medicine, then please go for these counts. And if they are very high, then search out along with RA, is there any other disease which has creeped in the form of other tissues which are getting destroyed, like vasculitis. I had a case where I missed that RA was being combined with vasculitis, and I missed to diagnose. The patient landed up into cross complication of respiratory failure, and he died. That time I realized that vasculitis was what I missed up. So X-ray definitely will tell you about erosions. Go for MRI. MRI will talk about soft tissues more firmly, but no need of going into repeated MRI. If you see that swelling has reduced, if you see that bogginess has reduced, the patient is able to flex the knees, the patient is able to perform daily. Please don't go on repeating all these investigations. This patient's son is too anxious and he keeps on performing, but now recently he had a son and this lady could perform so well. So therefore, when the review of the totality is done and the remedy is right, so in rheumatoid arthritis, if you follow the Hering's law of cure, so the pain, this is what Sir has said in his lecture, that pains should disappear from above downward. If knee pain is better but shoulder is worse, wrong. If shoulder is better but your fingers are not getting better, right? So the proximal joints should first improve, then your distal joints, right? So distortion of the joint should not progress ahead. If they have got those notes, Sir said ki distortion should not progress ahead. Means it is possible that with your remedy, this distortion will not revert back, because here you are giving a compensatory cure because the structural changes have gone beyond the limit. So deformity should go. This is your aim, but should not be your sole aim that deformity should reverse. If the nodes have developed, if the distortion is to swan neck deformity, or the distortion is like this, and it goes further, and if the right hand was affected, only left hand was affected, and right hand also gets deformed, your remedy is wrong. those high grade fevers which I told, where I failed in that case of RA, which was combined with vasculitis. I failed to understand that fever went. I tried to give specific remedies, and I could not understand why this person is not coming out, and really that syphilis crippled the body and that patient was gone haywire. So these syphilitic fevers should definitely not appear. If your patient has got intermittent high grade fevers and she says ki I just take a paracetamol and this patient is keep on taking these fever medicines, that is really very wrong, because these fevers should not come up, right? Then the patient are on DMRDs or the immunomodulators or any suppressant drugs like steroids, painkillers, definitely the need should go off. I have switched off all the medicines of this patient. The progress I have shown you, they are only on few supplements, that is on and off. I stopped vitamin B12 also once the levels were high, and she is on a healthy diet. And she says that now the pains are so gradually reduced that I'm able to perform, I'm able to go and help my family members. And if your patient says, oh, doctor, I was so happy talking to you, and I was like really happy, and I was happy, satisfied with whatever you have done in the case taking, and it was really a sense of well being, be cautious. If the sense of well being is there, but the markers are high, the patient is still complaining of the stiffness, inflexibility, then this is a suppression and this is a false cure, because this can be misleading. The feeling of healthiness can be also mistaken that the person doesn't want to complain. The person is contented, and that syphilis is creeping inside, and the person doesn't want to give trouble to others, like in natramune. The person doesn't want to give troubles to other, and therefore they just keep on suffering magnesiums, they keep on suffering, and they don't want to show their emotions to others. So just the sense of well-being, they tell you, okay, fine, I'm good, happy, but you can see the pain, the groans on their face. The movement are still painful, the joints are still inflamed, swollen and red. That means yes, it is in a wrong direction. So please take it with a pinch of salt. And because you are giving an anti-syphilitic remedy, or you are prescribing a remedy which is based upon the syphilis, this excruciating syphilitic pains should go off. I told ki the burning pains, the severe pain, the pains like the needles are pricking, the pains are so excruciating that they cannot move on the bed also. So those pains should start gradually reducing. It should not be in a sudden day, right? It should not be like one day one joint is affected, second day the second joint is affected. No, that is wrong. Gradually these pains should start reducing, that to follow the Henning's law of cure, and the pain tolerance capacity should increase, the dependency of the drugs should reduce. So there, if there was distortion, that should revert back with swelling and followed by simple pains, and the movement and the Sora of that joint, the function of the joint should be reverted back. Now, going back to the totality of our cases. So here in case number 1, when I committed a mistake, I'll tell you, right? So what mistake I committed here, I took before when I was taking it, I just took was she's diligent, she's conscientious, she's mild, and I tried to give her a remedy which was only Ignatia. I have that totality also. So I gave Ignatia, which was a wrong remedy for her. But then I reviewed the totality and I found out that inflammation of the joint should be definitely taken up, because it is at the syphilitic phase right now and it is an autoimmune disease affecting the joint cavity. She is a lady who is really punishing herself, and she wants that what mistake I've committed in my life, that I'm suffering so much, and she is so conscientious about her duty that she doesn't want to commit a single mistake in the future. And by disposition, she is a timid lady, definitely. So yes, we can have taken the other rubrics of delusions also, but at that time, to be very honest, I was not very prompt with what I have presented what was in my mind, right? What I did in my case. So I did not consider any delusion over here. Yes, you can consider delusions over here in this case. Number one is that key delusion of being criticized or delusion of being devalued. And she felt कि father-in-law ka jana is like कि my whole life is lost because I was living for my father-in-law, right? So such rubrics can definitely come up. And the remedy which I prescribed was because at that time, what she was saying is कि modalities were very important, that she was very restless. First movement was very painful, which is common. But definitely there was a strong modality in the whole case, which was aggravation from the rainy weather and cloudy weather. And last year, as you all remember, even at the Diwali time, there were rains. So she said ki even I'm not able to, I have that fear of going into the rains. So that only struck to my mind. And I just gave Rustox. Honestly speaking, then again, when I reviewed the case, that time I found ki yes, this was something which I was missing. She was always constantly trying to do few things कि मेरा सब कुछ अच्छा होना चाहिए, मैंने भगवान को प्रसाद दूंगी, ये करूंगी, वो करूंगी, ऐसा कर लिया था शायद इसलिए मेरे साथ बुरा हो गया. And yes, I need infrequent repetitions of Restox 10M, and that is what even Hahnemann sir has said in aphorisms, that when you're treating these one-sided diseases, first you can give is those cases is those pathological rubrics can be considered and specific remedies can be thought of if the mind is matching the Sora. And therefore, when I thought of, there were 2 to 3 remedies which were coming up. One, I thought of even Calcarea. But Calcarea mind was not there. She's chili patient, so Bryonia was even ruled out. Then arsenic, she was not sensorious like arsenic. And Hahnemann sir says ki don't miss the Sora. Example, he said ki a tarantula will never lose his restlessness anyways because that is Sora. So if you feel it is bryonia, then rest must ameliorate in all the phases, right? Even in syphilitic phase. So that was not there. Then I did not think of China. Definitely, it was not matching, not Merck, neither Natramur or nitric acid was matching her constitution. There were 2 remedies which were very prominently coming up was Pulsatilla. Even I thought of Pulsatilla, and Rustox and Cilicia was there in my mind. But Cilicia is definitely obstinate, and the non-complaining attitude of that person, she gets into weeping spell, was indicating towards Pulsatilla. But while talking to her, I found out that she was more workaholic and diligent, right? So I opted for a stocks. This is what true things what I have done. I didn't think of any delusions at that time because I was not getting into the mind ki what rubrics I could have taken for her. So this is what the case was presented to you, and Rustox 10M was given, and the whole process of the cure is being shared with you. How the RA factors have come beautifully down. This is 1 year's own time. I think the RA factor can come even negative because the deformities have also started reverting back, and I can see now no boggy swelling is there. Now in case number 2, where there was so much of humiliation and mortification was there, so I took the totality of case number 2. When I took this totality, I try to understand now from this angle ki what feelings he is going under. So he felt ki I should die now because I am suffering because of something which crime I have done in my life. He was too dignified to fight, and the remedy was very clear, and I prescribed him without even thinking of a second remedy. I'm very honest with you people. And when I'm thinking about ki there is mortification which has affected him, and there is the feeling that I am a criminal, and therefore this 50,000 rupees have been here and there, and now I will be blamed for something which I have not done. So that thought process, am I a criminal? And for him, that 50,000 amount was so big for him that I can never repay in my life. And the attitude that son had, so that was really insulting towards him, pointing that syphilis, that key point, and definitely a conscientious person whose joints were affected, leading to rheumatoid arthritis, and the levels were mad. The RA factor was more than 500. So definitely the remedy which I prescribed was staph 10M. And to the amaze, I will tell you, when I go through the follow-ups, I'll tell you he was suffering since 1 year when he had come to me. And when we gave him the first dose of Staphylococcus aureus 10 mg, he said, Ma'am, I'm really very surprised how my shoulder pain has reduced, but my knee pain is still there. My knee pain is still there. I'm still unable to walk, but my shoulder pain has reduced and my finger joints have also reduced. So is it not a good Herring's law which is being followed? Then he said was many kisi I want to work and I am a workaholic. I want to keep moving. And I gave him definitely an SL. Then he came back after almost every month he was coming to visit and the pain started reducing. And with that single dose only, I did not need any frequent repetition in this case. Even the knee joints get better. And he said, now I'm free of pain. Then do I need medicine? Because I cannot pay you so much of amount. And within 6 months, that is in first month, that is January, he came to me. And in April, he stopped treatment. And April, May, he stopped treatment. Then in between October, he came. And every year, once in a year, he comes. That one episode happened in 20 was that he took some vaccine at that time. And after that, his pain suddenly flared up. Suddenly, all the joints became stiff. And he said, I don't know why I'm suffering. Within 15 days of that vaccine, he became very back to stage zero. And I was really very scared. Then at that time, and all those vaccination, I understood that autoimmune diseases were really triggered. We have so many avascular necrosis, vitiligo cases, psoriasis, and even cardiac ailments have just propped in because of all those vaccines which were given and post-COVID complications also. So here again, I repeated a dose, and to the amaze, he went so. But what happened here? I again made a mistake. Was I did not give importance to the constitution, and because it was just because of vaccination I took, and I gave sulfur 10 which was not exactly the constitution, and nothing could change him. Nothing could change him, and there was no relief. And still the symptoms were same. Again, after taking the review, I found out that there was an episode again where he was again humiliated by the boss, and some subordinate tried to get irritable upon him and criticize him, and where I again prescribed staff 10 and that is way back in 21. After that, no doses being repeated. 22 he came back. After 2 years he came back, where there was a slight ankle pain and interphalangeal pain. Only second dilution of Staphylococcus aureus 10 that is dissolve into 1 cup of water. You take 2 spoon, put it into another cup of water, again 10 stir, and you take only 2 spoon out of it and throw away all the. So that second dilution, even that minutest dose, has brought cure to him, and we could see all the other symptoms also settling. And after that, hardly he needed any medicines for it. 23 he came up for some sorry complaint, no remedy was repeated. And then he came in 24 telling me ki ma'am, I really want to invite you for my daughter's marriage, and everything is hale and happy. And 25 again an acute complaint, and this is the case of RA. So as we summarize over here, we try to understand ki RA or any pathology, you should know the importance of investigations, the tissue that is under the knowledge of disease when you're treating these cases, because this case was with so much of dynamicity, right? I have almost so many cases of RA. I saw that they are very dynamic cases where the tissue or the disease is in such a dynamic plane. So if you see that RA factor is so high, CRP is very high, so don't go for low potencies. Go for higher potency, 10 50 second dilution. That will really bring wonders to you, right? So don't prescribe on something which is low, right? So give high potency and go with second dilution if you want that the dynamicity is so high that you want to repeat. So that can be repeated frequently without any aggravations which are or any accessory symptoms of the drug remedy, because this is autoimmune and with high dynamics you need frequent repetitions also. Even if you want, you can repeat every week, every month if it is required. I had a case where I needed cyclamen to be given very repeatedly, weekly, initially, right? Different cases, a male patient whom a single dose repetition and things have settled. But there are few cases where the deformities are so high that I need lot of frequent repetition, even weekly they are going on. But I'm not able to bring up the deformities because the age what they came up. I have a recent case of RA, which is of a very young lady of only 40 to 43 years old, and she's being referred from because her whole family is with me, her children's are with me, and she was being advised that you have to be, and she's very conscious for her weight and she wants to lose her weight, but very haughty and very bold to talk. But I was very amazed at why her RA positive has to come up and why she is suffering with ankle pain. Then gradually, before coming to me, she would never open her heart. But when RA came positive, she could say ki where she was being devalued by her husband because of her looks, because of her high weight. And she says ki my husband is also obese, but he feels embarrassed when I go with him to the party. So he doesn't want to take me. So I just want to cut out this weight. I have stopped eating. I'm punishing myself. I'm not eating since days together. Still, my weight is not reducing. So I want to really kill myself now. And this is what the thing is. Ki I am being neglected by my husband because I have overweight, right? So I just want to punish it. And a single dose of CPR at that time and has really brought cure, and no painkillers needed, no other medicines needed, because she's a lady who is very sensitive to allopathic drugs. So she cannot take a painkiller, even paracetamol. So she was more scared ki doctor, I'm so sensitive to allopathic drugs and now I'm suffering from a disease which needs so much of immunomodulators, and doctors have warned me ki now you have to be on bed because you cannot take any medicine. So I'm scared now husband will leave me only. So that fear, when encroaches, that devaluation encroaches the mind, the disease is being triggered. I have n number of cases, if you'll ask, so many cases. It was very difficult for me to put down all those cases in this presentation, but RA can be taken up in a dynamic level, right? So this is my presentation. Thank you, because this case, this whole rheumatoid arthritis has taught me that value of appreciating your own self and having gratitude for everything what you have in your life, starting from your knowledge to whatever people you have been gifted in your life. So gratitude towards you all people, also to all the gurus in my life who have played so vital role to shape myself so well, and to you all for being so patient listening and enjoyed the whole journey so patiently with me. So if you have any queries and doubt, I am really welcoming it. And if you want to discuss anything which you have not shared, I think you have gone to the core of rheumatoid arthritis. And this case or this presentation is not only about rheumatoid arthritis, but the whole inflammatory process, how it affects the whole musculoskeletal system, and the degenerative process or autoimmunity affects the individual. So we are at the end of the day. If you have a query for nail distortion, finger and toenails. See, again, I will tell you, when you talk about bones, you have other skeletal system or connective tissues of the body on which there are muscles and there are nails also, right? So these nails are for the protection. Like if you want to bite or scratch someone, right? So you want to just scratch them with the help of nails. So animals, they defend themselves with, they have those long nails, right? But as human beings, we evolved in our life, and we started defending ourselves with other weapons also. So we usually don't need so sharp nails, because we don't, and animals even tear off the flesh with the help of these nails, right? So this is a weapon what we have, right? So if people who have crippled nails, right? You have tinea over the nails. You have so many nail diseases where the nails are crippled, they are fragile, right? You have pigmentation over the nails. So those people who the tendency of keeping long nails, and they just, as a defense, the first thing is you scratch the person's face while defending. So if the person is timid and don't find themselves as valuable to defend themselves, so that will cause that nail disruption or distortion, or you will say cripple nails. And if you feel you are being undervalued and you are not enough to defend or to attack, right? So you feel you are very weak internally, so you have fragile nails also. So this is about nails. Anything else? Any other person who wants to ask anything? Great toe, right? When you talk about any tissue or any cell of the body, you talk about any pathology, right? You want to understand how the mind of that cell is working. Just understand what role and what function that whole organ or tissue is performing, right? And if that organ and tissue fails in that function, that is the emotional pathology exactly, right? So great toe is for firmness, for gripping yourself on the feet, right? So feet is for standing and definitely performance. But when you talk about great toe, it is regarding your firmness, or you get grounded, I say, right? You have firmness of your feet when you have a great toe, which is firm. So those people who don't have a great toe, they find themselves slightly difficult to anchor themselves. So foot is for anchoring and grounding, and definitely great toe is for that groundingness. Rheumatoid arthritis per se, you can have those questions, because if you talk about all the system, the whole anatomy, as I really enjoy sharing the emotional pathology, connecting it to physiology and pathology. So when you talk about other different parts of the body, again go and see what the function they perform and how in the disease those functions are getting compromised. If in RA having pain in the pain comes off and off, on and off, please wait and watch, because first see is it syphilitic. Again, take help of the miasms, because miasms are the yardstick. If the pains are very soric, comes with slight aggravation, and they are settled, then it is okay. If they are very severe, unable to handle, then please go ahead with changing the remedy. And if the, again, Hahnemann sir says if it's a change of totality, then definitely the remedy needs to be understood and reviewed. So deformity of finger joints persists, but RA factor and anti-CCP is negative. See, again, I will tell you, if the structural degeneration is there, and we are dealing with the autoimmune diseases where there is structural degeneration at the irreversible pathology. So even if what joints they have got into deformity, they are not getting reverted back, but other joints are not getting involved now, and there is no further progress of the disease, right? So definitely your remedy is right somewhere. You might need to change an antisoric remedy at this level of time. If the totality has changed, consider the Sora. Think of a GCS that might really help you to revert the further disease pathology. And if it is not reverted back, if it has gone into permanent change, then just wait. For sole, again, I will tell you, if it is a foot, it is again a performance. Like the knee is for performance, foot is also for performance, for grounding, and you stand on your feet, right? You stand on your sole. So sole is meant for a smooth walk. You cannot walk without your foot. You have foot pains when you are not able to use your soul in a proper way. So that is again a value system when you are not able to stay grounded, right? Anything else you want to know? See, Raynaud's phenomena is again a different connective tissue disorder, where you will see the blood vessel. Actually, Raynaud's phenomena is where I have a case where Raynaud's phenomena is very common in cases of SLE also, and Raynaud's phenomena is also cases of what you say vasculitis also. So this is because the blood circulation is not reaching the tissue, and the tissue they start getting necrosed, and this is not apoptosis, but this is a process of necrosis. So there will be lot of anger. Rather than anger towards self, it is anger for others. So you will see reproaching others, then death desire will also be there because it is necrosis. So it has to be a lot of anger and frustration. It is like killing the cell, right? The cells are getting killed and it is getting necrosed. So it is more of anger. I will share, let's call it end of the day. Thank you everyone. Once again, gratitude. So moral of rheumatoid arthritis is to enjoy the value system, accept whatever you are, start loving yourself, stay grounded, stay flexible, and have the gratitude to whatever you have in life and be satisfied and contented and enjoy each moment of your life with happiness and joy. Thank you.